Sorry.
I'm like, what is he?
Hi, this is Dr. Scott Hutchison for another Hutchison's Huddle. Today is May 26, 2020, and we're all in the thick of the COVID stuff going on, so I hope you're all safe and happy. The story is, I think that for fertility patients in particular, this has been incredibly anxiety provoking. And so we have, and a lot of other practices have proceeded to go ahead and reopen and allow people to do fertility treatment. But the rules have kind of changed, and to try to make things safer, we are, we've made several changes. So, and it may be different, and if you're in a different location, you may have a different, they may be practicing things a little bit differently, and maybe we're taking a bridge too far and overdoing things, but I'll tell you about how we do it. First, before I forget, my friend David Carnevale, who is not only a fine reproductive endocrinologist, but also and pelvic surgeon in Indianapolis, who was in fellowship with me, is a fantastic cook, and he has put together a YouTube channel which you should definitely check out, and it is called Pizza Doctor. The way I found it when I went back to go find his cooking program, I put in Pizza Doctor Beginner Pizza, and he's got several other like I think he does a braciole or something in there, but his honestly, like his instruction for how to make really good gourmet Italian pizza, and he's a great cook as well as being a great doctor, and he put in a lot of production value into showing you how to make healthy pizza. So I would encourage you to check that out if you have a hankering for pizza and you haven't been able to get out on your own. So Pizza Doctor Beginner's Pizza. And I think you'll really like that. Anyway, what we are doing here at Reproductive Health Center is we're all getting COVID testing before the start of IVF cycles and midway through, and that's what we're doing with our patients as well. The overall the spread of COVID, and I may have, if you haven't looked it up, look up the Erin Bromage, Dr. Erin Bromage. It's spelled E-R-I-N, and then the last name is B-R-O-M-A-G-E, and he is a virologist who teaches in Florida, and I really found his blog post to be especially enlightening about transmission of COVID as being mostly a droplet-borne illness, and in being, length of exposure in a room and close confines and all that really make a huge difference. So the way we are doing patient care as well is it's only one patient in the office at a time. So we don't want people being able to be in close proximity. We have been able to do that, I think, like the dentist, by sometimes just extending hours out so that we don't have to have as many people in. We try to run on time. We try to minimize discussions in the office so that we can do that. Patients come to the office at their time. They call to let us know that we're here. Then they come in the office wearing a mask. If they don't have one, we go ahead and give them one and make sure they're wearing it correctly. And then they can empty their bladder, wash their hands, and then the room that they're going into has been sanitized on all the surfaces, and so forth. And then we will repeat that throughout the thing. We're also telling people, we also do temperature checks on everybody coming in. I don't know how really useful that is. I think that you hear stories about, people, if they're just standing in the sunshine and you take their temperature, it can be 103. But regardless, if people are feeling ill or they're ill, then we are not going to let them in the office. Obviously, that puts a wrinkle in there for us as well, because patients invest a lot of time and money into doing an IVF cycle, and if one of us gets sick, it could throw everything apart. So you'll need to be aware of that. Also, our anesthesiology. Anesthesia is in relatively short supply in Tucson here, and the anesthesiologists who had been scheduled to do our cases had to have emergency surgery. We had, luckily we were able to dip into a recently semi-retired colleague, and she was able to come in and do our anesthesia. But if the people who are being immediately in proximity to you are getting ill, then they're not going to be able to be in here, and so those IVF cycles and insemination cycles will have to be canceled. The question, there was a question: is my partner able to come to the testing with me, or should they remain at home? We're telling everybody to have the partner remain at home or out in the car. Obviously, around here it gets hot in the summer, so we don't want people just sitting in a hot car. But we have patients bring along their telephone, and if they want to, FaceTime their ultrasound or exam with a partner, that is perfectly fine, so that we can actually show them what is going on. Also, a couple of people, another question was, are you doing telemedicine consults, and why? Well, I am loving this telemedicine thing. I think it is fantastic, because we actually have a little more time to go over all the lifestyle stuff. I feel like I get their history better. It's also it seems like it's incredibly less anxiety provoking for people if they have that first visit and in the comfort of their own home or office, and then they'll come in for their physical exam and pelvic ultrasound. And it just seems to be a lot less anxiety producing for patients. And I feel like we're getting a better initial history and physical than we used to do. So I'm kind of like, what's not to like? It takes a little more time, but I think it's fantastic, and it's nice because these folks can just be sitting on their couch and petting their dog, and then we can, get this work done. What other things was I going to tell you? Oh, and then, clearly so again, look at that Aaron Bromage. Again, it's BROMAGE. Wearing masks is really super important with all this. There's vagaries with testing. There's vagaries with reporting, clearly, because, when if a hospital gets to declare a COVID death as being able to be reimbursed for more money, that would create an incentive to label everybody's a COVID death. But regardless of that, I was looking at the stats today, and the United States has about 328 million people. South Korea has about 52 million people. We've had now 1.6 million cases. South Korea, a lot of these Asian countries, they've been wearing face masks for a long time, just out in public, so they kind of have gotten used to it. But instead of having 1.6 million cases, they have now had about 11,000, 12,000. The United States, we're pushing 100,000 dead. South Koreans are at 267. So proportionality is huge here, and I would just encourage you to wear masks and avoid being indoors with a lot of people, with a lot of yelling, coughing, singing. Things like choir practices, sports events. I think we're going to really need to kind of rethink those. Certainly, if you have to be in that sort of environment, I would definitely wear a mask. I was talking, and people are doing things differently. Our daughter is an attorney back in DC, and her firm is just working from home, which I think is the best thing you can do. because they really don't need to be in meetings. But then I talked to another attorney today who's here in town, and they're all back in the office, like it's okay, and sitting in these conference rooms and being kind of close together. And no, that's just not right. So anyway, if you have any other questions about it, then give us a ring. And then check out our other Hutchison's Huddles with some of my co-workers talking about different topics such as endometriosis and all fertility topics and IVF and all that kind of stuff. And take good care of yourselves. And hopefully we will see you down the road here for another huddle. And again, check out my friend David's Pizza Doctor Beginner's Pizza on his YouTube channel. And have a great night. And thanks for tuning in.